Well, it happened again. For the third year in a row, the number of employees in the U.S. testing positive for illicit drugs increased. That streak has never happened before. Since Quest Diagnostics started collecting this kind of data in the late 80s, they're the leading provider of workplace testing in the world, the rate of positive tests has steadily decreased. We did see a little bit of an uptick in 2003, but it went right back down the next year and continued to go down until 2013, when the rate of positives went up. Then again in 2014, and again in 2015. So what the heck? Without getting into the nitty-gritty numbers, you can check out the whole report right here. Let me give you some of the highlights. First, what drugs are impacting the increase the most? Well, of course, marijuana, where we've seen a 25% increase in the positivity rate since 2011. Last year alone, almost half of the people testing positive had marijuana in their systems. Amphetamines, there's been a 44% increase since 2011. And the rate of tests positive for heroin has increased 146% since 2011. Not that you need any worse news, but these increased positives were for urine tests that typically show what someone's used in the past 1 to 3 days. When you look at the data for hair testing, which can show repetitive drug use as far back as 90 days, the rates of positive tests are even higher. This data is probably not surprising to those of you who have been feeling the crunch in the hiring process. For years we've been hearing that employers are having a tough time finding workers who can pass a pre-employment test. What's even more concerning about this new data is that the rate of positives after accidents has increased too. So it's not just people looking for jobs who are testing positive, it's our existing workforce. So what's the employer to do? We need workers, so it could be tempting to drop our drug-free workplace standards. We're talking to employers who want to stop testing for marijuana, not do random anymore, or stop testing altogether. Maybe you no longer offer second chances to employees who have a problem. And while these options might feel like a quick response, I'm not sure anything's going to change in the long run. Employers, keep at it with your drug-free workplace programs. Educating your employees, really educating them, not just crossing it off the list, has never been more important than it is right now. And training your supervisors to see early signs of use and supporting them to step up is crucial. And don't forget how powerful businesses are in motivating people to get help. And if you're hesitant to offer second chances or think it's too much of a hassle, call us. We can look at your process and resources and offer suggestions. So stay the course. Employers, you play a very important role in improving and preventing our community's drug problem. Stay the course.